We've got an absolutely wonderful weekend planned for you guys. As Kathy said, we want you to enjoy, we want you to learn, we also want you to be inspired, and we want you to meet each other. We want an organization filled with volunteers who understand this as a commitment, but as a commitment of I can do a little bit more because I know that at the end, behind the word health disparities, behind the word global health and health promotion, are those faces and those people and those communities and families on the ground.
This is all very complicated. This is hard work. And what I use the term is radical incrementalism. And you really need to keep pushing to get everything done and keep everyone's feet to the fire, whether it's the government or pharmaceutical companies or universities or presidents, mayors, governors. But you also need to know this work is sometimes incremental. It doesn't happen overnight. And if you keep that in mind, you'll keep up the good fight. If you think this is going to happen overnight, this is not the place for you. You've got to be in this for the long haul. You've got to make this long-term commitment. And I can tell you, since doing this work, really since 1970 to today, that every minute fighting the good fight to preserve and protect people's good health is worth it.
It's always a struggle, of course, going, particularly me as a foreigner, walking into a place like Haiti or Kenya where I've done a fair amount of work, recognizing that in fact there needs to be structural change, and recognizing that there are elements of culture and tradition that certainly play a part in all of that. And how can I, as an individual and an American, play any role whatsoever, or should I play any role whatsoever in trying to address those?
You need to go into this experience and say, this is great, but what can we do better? And if I'm going to work in the global health field, what do I want to see better and what do I want to see change? Because this isn't a perfect system and it needs everyone's mind on it and critical eye to make these things better and better.
None of us can do it alone. It's amazing how much you can accomplish if you don't care who gets the credit.
Health was just another lens to very viscerally understand what social injustice meant. Dr. Paul Farmer, I know, is an inspiration to many of you, and he always says that global health is just a fancy word for justice and action.
And if you keep your minds open, if you keep questioning, if you keep thinking, and if you keep using your experiences, Timmy, not just to go on a trip, but to go on a trip and to face some of the very harsh realities that are out there. And by facing those realities, become more committed, more interested, more able, and more equipped to deal with them. Whether it's through fundraising on your campus, whether it's through an advocacy project, whether through volunteering with Timmy for a longer time, or whether it's simply through your careers that you're all going to have. If that comes out of your Timmy experience, then we as an organization will be absolutely successful.